reconvening the House Early Childhood Finance and Policy Division. And we do have, I suppose, continue to have a quorum. So we've got Representative Bonner up front, and we're moving to member questions now. And Representative Heintzman, I know that you had some. We'll start with you and then move to anybody else that we want. So Representative Heintzman.
So thank you, Mr. Chair. Launching right in.
Please do.
Representative Bonner, just we're looking at a couple of different things here, and definitions is part of it. But I think I'll start with a question, and I'm hoping you have both the amended version and the original. If that's possible. I saw that there was some changes in the original compared to the amended version, and I just wanted to know why. And so I'd be specifically looking at the original version in 1.13. And what I see missing in the DE is a line there that specifically mentions that the programs, I think, are targeted culturally or ethnically, and that's no longer in the language in the amended version, and I was just wondering why that isn't being included.
Representative Bonner, it looks like you've got a friend up there as well, so it looks like maybe she will. So if you can identify yourself for the record, and then please proceed.
All right. Mr. Chair, members of the committee, my name is Laura LaCroix DeLune, and I am the coordinator for the Minnesota Coalition for Targeted Home Visiting. Representative, to your question specifically, we worked with the Department of Health, we worked with the county and tribal health departments across the state and some of our model programs to find language that was consistently found in statute. And the reference that we had formerly on line 1.3, as you mentioned, it was difficult to have definitions around that and implement consistently across the state. And so we opted to utilize language that was already provided in statute and agreed upon language.
And Ms. LaCroix, you're referencing line 1.13, I think, rather than line 1.3.
In the original bill.
In the original bill, 1.13. Okay, Representative Heintzman.
Yes, thank you.
Thank you, Mr. Chair. No, I appreciate that clarification. I didn't understand why that might have been moved and changed. So I might
Mr.
transition now, if it's okay, to another question.
Representative Heintzman, it sounds like Ms. LaCroix DeLune may have something to add on that, if that's okay with you,
Mr. Chair and Representative, sorry, one more clarification. Part of what we were afforded the opportunity with this bill and with this delete all is we had a minimum amount of language that was in rider, and now that we're codifying it, it allowed us to have the opportunity to define these things. So you'll see some of the original language in House File 1226. We tried to bring as much of the original language forward from the rider, but as we worked with research and worked with the department, we realized we had a real opportunity to just get it right. Sometimes the language is compromised over time in a rider, and that's what we had previously in rider language.
Representative Heintzman.
Thank you, Mr. Chair. I'll be moving now to the DE since we got that cleared up. And some of the definitions, and I'll start in line 1.16, trying to figure out here what exactly is, and I know that we had a presentation, Mr. Chair, earlier on some of this, so we may be having to kind of draw back on some of what we may have heard, but evidence-based home visiting program, how are we defining evidence-based home?
Ms. LaCroix DeLune or Representative Bonner.
Mr. Chair, Representative, the language here, what we are trying to do is be consistent with the language that our Department of Health staff, Don Reckinger, mentioned earlier today. So these definitions are consistent with what HRSA uses to help identify evidence-based programs. So we wanted to bring that forward and codify that as well.
Representative Heintzman.
Thank you, Mr. Chair. So I guess what I'm trying to figure out is who makes the determination that a program is evidence-based or evidence-informed?
Ms. LaCroix DeLune.
Yeah, Mr. Chair, Representative. In this case, what we are referring to is the part of the presentation you heard this morning where Ms. Reckinger mentioned there were 14 to 17 different evidence-based programs. Again, we're using those that have been defined by HRSA as evidence-based. There are 6 that have been identified in Minnesota. So unjust by moving this language forward, we would say those 6 that are being supported through the Department of Health would meet that criteria.
Representative Heitzman.
Thank you, Mr. Chair. So the question is coming up, of course, because, and I'm sure some, members, of course, heard the testimony, and you probably did as well. How is information being protected? And we're trying to make absolutely sure as best we can. And there's still, I think, a lot of questions as to determining that there's no possible way to work backwards through a third-party system to determine who's who. And to me, that there's maybe not an answer that is going to satisfy that specific question at this point, but I do want to bring it up in public testimony. That's part of the reason that I brought us to this. Sorry, Mr. Chair. That
No problem, Mr.
situation. But of course, privacy is a very sensitive issue, and that's why we're probably still here talking about this. And so I would add to that: is there any place, and you had already kind of referenced it, I think, but is there any place you can point directly to where these evidence-based definitions were drawn from in this bill?
And Ms. LaCroix DeLuna, I know it looked like Representative Bonner had want to say something earlier too, but why don't we get an answer to Representative Heitzman's question? Yes, Ms. LaCroix DeLuna.
Yeah, okay, Mr. Chair, Representative. The evidence-based definition comes from, follows what HRSA uses, so the federal government, how they define the use of the federally funded evidence-based program. So we were trying to mirror that so we would be consistent here in Minnesota.
And Representative Bonner, it looked like you had something to say before.
It can wait.
Okay, Representative Bonner. Representative Heitzman, you still have the floor.
I appreciate that, Mr.
Yeah.
Chair. I will go ahead and allow another member to ask
Oh,
questions.
okay, and
My hand is up.
no problem. And I actually want to say, as long as you'd said that before, that that members absolutely should have the time to ask questions. So I don't mind at all us coming back. I'm apologetic to everybody else for just the way the timing worked out. But no, you deserve to have questions answered, and that's what we're doing here now. Representative Pryor.
Thank you, Mr. Chair. And so I was thinking back to the testimony this morning and what we're talking about evidence-based programs. And because we were all there, it's a quiz. It seems like when they're talking about they're saying these programs qualify for the grants because they are evidence-based. But I think what that meant is that the research has been done to show that they, that there is, that they do demonstrate improvements in the ways that we wanted to see them demonstrate improvements. So in a sense, when we're talking about evidence-based, that's a past tense thing. That's what I understand from when they were talking about evidence programs in the presentation this morning.
Maybe we'll have Ms. LaCroix, if you've got anything you want to add or correct or adjust to how Representative Pryor characterized that. Looks like she.
Yeah, Mr. Chair and Representative, I think that's fair to say. I mean, these are rigorously evaluated programs that have been proven time over and over again. So, I mean, I would say these are kind of like the gold star standard because they've been replicated in different communities across the country. And each of these, I will just say about the privacy concern, each of these programs, I just want to really be clear, they are all voluntary and that parents at any point in time can choose to opt out of a program and leave a program, as well as they can, decide which parts of the data that's being collected is collected. So we work really hard, whether the home visitor is a public health nurse or a social worker or a paraprofessional, we work really hard to allow families to have as much control over that process because so much of the home visiting work happens because you have a strong relationship with that person. And if you would breach their trust on data, you would lose them as a client.
Representative Morrison.
Thank you, Mr. Chair. Either to the author or the testifier, and I apologize for walking in late, but I'm wondering if you could explain what the link between using evidence-based practice and concerns about privacy might be.
Ms. LaCroix DeLune, Representative Bonner.
I'm not sure if I understand the question.
We could ask Representative Morrison to
Well,
Can you
clarify.
clarify just a little bit more?
I'm not following, I'm not following Representative Heinzman's train of thought of what using evidence-based practices in these home visiting programs, how that potentially creates privacy issues.
And it may be that that's a question that's directed to Representative Heinzman, perhaps, to clarify his own question. If Representative Bonner, if
The short answer is there is no link.
well, let's let Representative Heinzman clarify his own question.
I don't want to create a,
Yeah, just make sure we understand, or if there's Representative Heinzman, anything that you want to.
Thank you, Mr. Chair.
problem.
And I don't know if folks are looking directly at the language here, but we see on line 1.6, definition of evidence-based home visiting program, which means a program that is based in a clear, consistent program, moving on to line 1.7, or model, and then it goes on further. And I think that the big concern is when we go and we drop down to line 1.17, evidence-informed home visiting program means a program that has data or evidence demonstrating a program's effectiveness. Well, as we were hearing in testimony earlier, because there was a number of folks that testified and shared their concern as to how a third party is going to be managing data. The first-hand folks are going to be, as I'm understanding it, looking at this evidence-based information, which is, I think, very direct, whereas where we're looking at informed evidence, and the testifier can correct me if I'm wrong, but informed evidence is going to be, in most cases, my understanding, a third party that is going to be looking at this information and making determinations without knowing necessarily who, and identifying individual students, but still being able to generate information that's useful to the legislature. And here again, like I said, if the testifier would like to clarify, that's fine, but that's my understanding.
Maybe we'll have Ms. LaCroix DeLune. Why don't you provide some shed some light on this for us?
Sure, Mr. Chair, Representative, thank you for clarifying that. There may just be some misunderstanding about what this language means here. So to clarify, evidence-informed means that a program, it uses the evidence in their program design. So they build their program design based on evidence from these models, the evidence-based models on 1.6. But they haven't gone through the rigor of being connected to a university, so they can't call themselves a model or an evidence-based program. So they have, so they have outcomes showing that they are working with families, working with kids, some of the same things like developmental outcomes for the child or for the mother around maternal depression. All of that data is collected and de-identified when we talk about reporting back what we know. So you are, because this crosses over, right? So it's health protected data. The data that we are interested in generally as a state is how it's aggregated together. So we go over and above to try to protect that individual level data, but it's really the de-identified aggregated data that helps us make policy decisions. So I think the point you're raising is valid because we want to protect people's data. And I will just say all the programs that we work with, whether it's local public health or nonprofits or tribal health, they follow all of those statutes. I mean, that would be a responsibility or they would lose funding. And more importantly, they lose the trust of the families they're trying to serve, right? So we work really hard to honor that relationship. But the evidence-informed data, we're talking about aggregate level data here. We're not talking about the individual data here.
Representative Heinzman.
I think what I heard was that I had that basically right, so I'm just to confirm.
Ms. LaCroix DeLune.
Mr. Chair, I'm sorry, I didn't hear what you just said.
He was saying that he had this, that it's heard from you that was basically right. Is that
That's what I'm hearing from you.
Ms. LaCroix DeLune.
That you're,
That Ms. LaCroix DeLune, that you had what Representative Heinzman said as being basically correct.
I don't,
I'm
Mr.
asking-
Chair, Representative, I don't
Sorry.
think so.
Actually, so
Representative Bonner.
Representative Heinzman, hopefully I can shed some light here a little bit. I think the assumption was made that this data was being shared with third parties, which it is not. You are not sharing identified data. Personal data, or PHI or PII, personal health information or personal identifiable information cannot be shared under HIPAA privacy laws. So when you're talking about trying to establish whether something is effective, you can share data that is de-identified. So what that means, for those of you in the room who are not familiar with this, is so, for example, you could have a data set and you can pass on specific pieces of information. So, for example, if I want to know if something's effective, I might want to know I want to know how well 5-year-olds do with a certain program. So I might pass on a unique identifier. I might pass on the age of the child. I might pass on information on the specific program that they're involved in, or a specific marker that shows the results of that program. But we would not be supplying specific identifiable information, such as we would not be passing on information like your address. We would not be passing on information such as a child's name. You would not pass on anything that could identify that child specifically. So you will know that a 5-year-old participated in the program, and you will know perhaps the dates they participated in a program, and you can see other markers or results-based information from that program, but you will have no idea or way to trace who that individual child is, or trace them back to their parents or where they live, or any of that type of information. That's how de-identified data works.
Representative Heinzman.
Thank you, Mr. Chair.
Yeah.
No, those are things I already knew. The issue is, and this is what we heard in testimony this morning, and part of the reason that I had questions beyond what we had already had an opportunity to ask, was that there are folks that believe that this information that is being, that is evidence informed, which is being used to generate usable data for folks that might be in a third-party situation, could use to still identify individuals after that point. Now, that may not be the case, but I was wanting to try and get some more clarification to understand, because when we looked at the original language that we transitioned away from, these definitions weren't there. That's why I was trying to figure out where those definitions came from, and maybe why, and who generated those. It doesn't mean that we're necessarily wrong, but I wanted to make that clarification, because if a third party could go back through de-identified information and determine who, based on dates and other information that was included, who a student was, and that information doesn't go away. That lasts forever and ever, and I think it's an important issue to discuss further.
Ms. LaCroix-DeLune, you want to comment on Representative Heinzman's concerns at all?
Mr. Chair, Representative, I believe your concerns are addressed in all the agreements that we have with families. But to your question about who helped create these definitions, the definitions were created together through the Minnesota Department of Health, the local public health association, the coalition that I support, and then some of the model programs who operate here in Minnesota. So several organizations and state agencies who do this work with home visitors across the state were involved in creating these definitions.
Representative Heinzman, are you moved a couple
I
folks?
appreciate that,
Yeah, no,
Mr. Chair, and I guess that would be my final comment, so to speak, on that issue. I wish that the state and federal government had an absolutely perfect, flawless record on this issue, but of course there are examples where that hasn't been the case, and so I think that's just an important part of this discussion.
And thank you for raising it, Representative Heinzman. And we've got a couple other folks, and it may be that provokes more, and feel free to dive in at that point. So Representative Morrison, you're next up.
Thank you, Mr. Chair. I just wanted to thank Representative Bonner for bringing this bill forward and expanding this program for our really vulnerable parents and children to help get them off to a great start. So thank you so much for your work.
Representative Katiza Watun.
Thank you, Mr. Chair. I just wanted to clarify something I think I heard from Mrs. Reckinger this morning, and then again from you, Mrs. LaCroix-DeLune, just earlier. So not only are these programs completely voluntary, so even if a doctor were to recommend that a child participate in this program or that a mother receive home visiting from someone at the hospital, someone through a different community organization, that family has the choice to say, no, thanks, I appreciate the information, but I'm going to pass.
Mr. Chair.
Ms.
I'd say
LaCroix-Dillon.
That's correct.
Great,
That's
thank
correct.
you.
Thank you.
So if they began the program and decided to no longer continue, they could opt out of the program at any point, correct?
Ms.
Mr.
LaCroix-Dillon.
Chair, Representative, yes, that's
Thank you.
correct.
And
Representative
they
Cortez-Mattson.
also, if they're concerned about data privacy, could say, I actually don't want any of my data shared, or you can share these pieces of my data. So they ultimately have whole control over what could be used in the program as de-identifiable data. Is that correct?
Ms. LaCroix-Dillon.
Mr. Chair, Representative, they have control over what data is collected, yes, absolutely. And at any point, they could even ask to see what data is collected.
Okay, Representative Cortez-Mattson. I should say, by the way, the two of you have very tongue twister names that I'm struggling with. Cortez-Mattson, LaCroix-Dillon. Anyway, Representative Cortez-Mattson. I'm
Those are-
hanging on for dear life.
Thank you, Mr. Chair. Those were just really important points of clarity. So I just wanted to make sure that families do have that control and they can make those decisions for themselves at any given point, participating in the program or not, sharing the data or not.
Okay,
Thank you.
good. And any further comment on that, Representative, or Ms. LaCroix-Dillon, Representative Cortez-Mattson's points at all?
Yeah, Mr.
like
Chair.
you agree with them, I guess?
Representative, that is correct.
Okay, thank you. Any other questions from members? I guess we'd closed public testimony before, we had that. And so, and I want to echo Representative Morrison's point that of thanks to Representative Bonner and to Ms. LaCroix-Dillon, who's worked on this issue for a long time. Home visiting is just proven itself, I'd say proven both through evidence-based programs, evidence-informed programs, to have an amazing impact on families. And I know these proposals have the support of the Minnesota Catholic Conference, and I think they have, you've got Republican support authors in the Senate, I believe, and so just some pretty amazing programs. So unless there's anything else, with that, I will lay this bill over for possible, oh, pardon me, there is somebody, Representative, oh, okay, we're holding off, okay. Over for possible inclusion in HHS division report.